Hello.
That was effortless.
I know, right? Like I've done this before.
I always love when technology
I
works.
I know.
It's
How are you
amazing.
doing?
I'm good. How are you?
I'm good. Got my coffee. Got my sleep. I'm ready.
So important. I've been so excited about this. I've been talking about feet all week, and people have been throwing their questions at me. So I'm like, I'm talking to the functional foot doctor today, and we get to dive into this. So welcome. Hi.
Thank you.
Why don't you tell us a little, just a quick bio in case people aren't aware of who you are? Give us a little intro.
Sure, of course. So, Dr. Emily, I'm a functional podiatrist. So, I am trained as a podiatrist, but I approach patients very differently. I approach them from an integrated perspective. I get most of my patients out of their orthotics into minimal shoes or strengthening their feet. I look at the body very integrated. So, I'm also a human movement specialist, and I do a movement assessment, gait assessment on every single one of my patients. I was trained as a surgeon, so that is important because I always have that lens of surgical perspective, and I will oftentimes be a second opinion for patients. Do they really need surgery, or could we look at something else? So now my practice is based around functional and regenerative podiatry, and I don't do surgery anymore.
Wonderful. Yay. That's wonderful. You wear a lot of hats, which is why I'm so excited to be talking to you. So we have about half an hour. And obviously I want this to be a discussion, but I have questions for you. So I'm just going to dive in and interview you here. So, I'm a pelvic floor movement therapist, longtime Pilates teacher, yoga teacher, all of those things. But my pelvic floor work has always strongly featured the foot and the feet. But they hear it from me. And I would love for people to hear from you what you see is what is like on a basic level, because I think we're not necessarily taught that like everything is connected. So in a basic level, can you explain to our listeners who are probably not doctors, they are just like people, what is the connection between, like, is there a connection from the foot to the pelvic floor? And what is that connection? Like, how does it show up?
Yeah, I am. I'm so glad that you appreciate the foot as a pelvic floor specialist because unfortunately in Western medicine, it's very segmented. So we need more professionals like what you're doing to bring this integration. Now, the way that I focus on feet and movement is really based around walking. And I consider the ability for us to walk is the most important functional movement that we can do. Actually, our brain and our nervous system and all of these fascial lines were developed because we stand on our 2 feet and we walk. So I just want people to keep that in their mind that walking is literally everything. And then when you think about walking and standing up, you have to think about gravity. And gravity is a very important sensory stimulation to our nervous system, to our connection to ourselves, to the pelvic floor. And really what I like to think of is we're standing up. The only contact point between the body and the ground is our feet. So that's obviously very important, your foot strength, your foot awareness. And then when we're standing up and moving, you think about where is our center of mass or our center of gravity. It's obviously the core, deep core, pelvic floor is what is stabilizing it. So the contact with the ground and our center of mass has to be connected because of how we stand up and how we walk. And then it's connected through fascial lines. It's connected through joint movement. So every time your foot moves, your pelvis moves. And then it's also connected through muscle synergies. And this is one of my favorites. So research has shown that when you activate certain muscles in the brain, specifically the one that controls the big toe, your posterior pelvic floor, your levator ani actually activates. And to me, that is a fascinating demonstration that we were designed to move. And that's what I take away from that. We were designed to walk. And to optimize these connections, you have to keep moving.
Yeah. And I think that what you say about the big toe is so important because the way I discuss it in my programming is that during that push off, you talk about the phases of gait all the time. I've watched your webinars. That push off, we are activating that whole posterior chain. And that is activating the pelvic floor. And so when people have things like, and I would love for you to talk about this a little bit, but when people have something like they turn their feet out when they walk, or they have bunions, or they have a lot of foot pronation, or they have a lot of supination, we might assume that they're not getting to their big toe. They're not getting that push off that is so important, not only to gait, but to the pelvic floor. Like, is that something you see in your practice?
Absolutely, 100%. And I think a lot of people intuitively feel this as well, because I've had patients say, oh, Dr. Emily, when my bunion became this big, it's like I can't feel my glutes anymore. I can't get into my hip. And I'm like, you are like, good job. You are very intuitive in your body. And yes, it has to do with those connections, the fascial lines, the muscle synergies. Also, what's really important for the listeners to appreciate is if you can't get over your big toe, maybe it's a bunion, you have arthritis, whatever it is, your step length has to shorten. Yeah. And as soon as you take short steps, you now no longer get the hip extension, your pelvis doesn't rotate, your T-spine doesn't rotate, and we move in a very apropulsive way, which is really damaging to the fluidity of the body. And I'm sure you go into this with your clients as well, but we have to be able to take long steps and walk at a certain pace to really optimize the power of human movement.
Yeah, I often talk about the lengthening that the front, like the psoas, right? Like, yeah, we need to get that hip extension and the glutes. And I think also because we sit so much, and because we are unfortunately trauma echoing trauma, and that does create a curl in. We have a lot of things in our world that support curl in patterns. Yep. And curl in patterns are not necessarily effective for efficient gait patterns, which is then not effective for efficient pelvic floor patterning. I want to ask you, while we're on this, it's so interesting to me. So one of the important things about gait, as you have said so beautifully, is that we need to get to the big toe. We need to push off. We need to be able to create that locking, unlocking. So the foot locks and unlocks. I would love for you to talk about that in lay speak, like help our listeners understand what that means to them, not just to like doctors and professionals. Yeah. But the pelvic floor also locks and unlocks. And what I see a lot of issues in my practice with the pelvic floor is that people's pelvic floor is not locking and unlocking, and their feet are not locking and unlocking. So there's like this locked mechanism happening, foot to pelvic floor. I'm curious how you could describe that in lay terms, and what you see, like what is the reflection of like that inability to lock and unlock the foot? How do you see that showing up in the body?
Yeah, I love that you use those words too, because that's there's such a podiatry thing. And I was just at a conference talking about foot movements to fitness professionals, and I was describing locked and unlocked, and I was like, this is very important. This is not like lock your knees, unlock your knees. Like it's not used in that same way.
Right. Thank you for making that distinction.
Yes. Where it's not like I'm locked, right? It's very different. So one, I like that people remember that movement is dynamic, and we are continuously dancing. Like we're dancing with the ground. We're dancing with impact forces. The body is this ebb and flow. We have to go down to go up. We have to lock to unlock, and essentially we go back and forth into it. The way that I like to describe locked and unlocked is that we have to be able to unlock our foot to absorb energy. It's a deceleration moment in the foot, and then to
so the foot will literally unlock, like it literally lengthens, spreads. Can you discuss what it does?
Yes. So an unlocked foot is essentially pronation. That's what a moment of unlocking is. So if the listeners are standing and they want to kind of do it, if you stand with your feet shoulder width apart and then you roll inward on your feet, which is essentially eversion or pronation, this unlocking moment, which is a flattening and a widening of the foot and an eversion and a dorsiflexion of the ankle, you're just collapsing in. That is how you absorb energy. You have to be able to unlock the foot to absorb all of the energy that comes from striking the ground. Then you do the opposite to lock, which is roll to the outside, that's inversion. It's a little bit of a plantar flexion of the ankle, external rotation, or a lifting of the arch. We'll just say that.
Right. So arch is lifted.
Arch lift. Yes.
Arch is lifted is that locked foot, and then arch is dropped. If we were speaking like fitness speak, is the unlocked foot.
Yes. And we have to be able to unlock and lock. And then if I can just add one more thing, because ultimately what a locked foot is that we have to become a rigid lever. I'm obsessed with the rigid lever. The rigid lever of the foot.
For good reason.
Is when you do like a calf raise. So my hand really is not going to do justice on it.
Yeah.
But if for all the listeners, you're like, oh, do a calf raise with your foot on the ground, and then you see it in that beautiful, almost like a high heel position, right? Yeah. That is called a rigid lever. That is the queen of locked feet, because that is ultimately how you push off and you take a step.
Right.
Yeah.
Which is really important as it reflects into the pelvic floor. So this locking and unlocking reflects upward as well, which is incredible. But keep going. It's fascinating.
Yeah. I was just going to say then this dance between unlocking and locking, it's happening within milliseconds. So you really can't see these things in the foot. So that's where I want people to understand that it's a moment, it's happening. Thinking of it as a moment, so it's a pronation moment. People are kind of like, huh?
Right. Which is where that dynamic training is so important, because you can't walk around forcing lock and unlock. You need to train it, right?
Yes, and it's happening subconsciously. I'm so glad you said that, because I've had people come into my office walking kind of like the Feldenkrais walk, like really slow. And I'm like, oh my God, this is when I was practicing in New York City too. I was like, how do you get anywhere?
Yeah.
Like, you can't. Walking is subconscious. Actually, human movement is subconscious.
Yeah.
And
so is the pelvic floor. It should be reflexive.
Yes.
Which the problem is we're all overriding it by tensing it all the time, trying to get it tighter and stronger. Yeah. It doesn't work in the foot and not in the pelvic floor.
Yes. And that's why I think that there are two beautiful structures that are so synergistic. They're a team, right? And they are just working together in this gravitational dynamic dance that we do with the ground. And we just have to kind of weave in and out. If I may add that injuries, specifically to the foot, and I'll let you kind of speak in the pelvic floor area, but in the foot, if someone can't unlock or lock fast enough, that's where you get injured.
Yeah.
Yeah.
That's interesting. So and I would say in the pelvic floor, it's a little different, because the pelvic floor is not shaped like the foot, right? It's more of this doming, hammocking, and it's also a receiver. The pelvic floor is receiving so many forces, and it's a transmitter, just like the foot. It's a transmitter and it's a receiver, but it's not shaped like the foot is shaped to get into that locked lever position, that rigid lever position, right? It's shaped to kind of bring us in and out of gait, whereas the pelvic floor is not designed to do, the shape of it is different.
Right. So I guess also you're dealing with like a fascial muscular, myofascial versus this osseous complexity of bones that is just vibrating with the ground.
And you're also dealing with an area that is bearing the weight of all these organs.
Yes.
The uterus, and if you don't have a uterus, there's many other organs, right? The bladder, the rectum, there's just a lot of organs there.
Yep.
The pelvic floor, the foot does not have organs sitting on it. And yet the two are so mirrored in that it is so, they're so mirrored, like you said, fascially and neuromuscularly and nervous system. So I know a lot of people want to know about plantar fasciitis. It's always and I'm looking at the comments and people are definitely like, what about plantar fasciitis? Plantar fasciitis, I see it in a lot of my pelvic floor clients. I see it in a lot of people. I know that you and I are on the same page with get people barefoot, not everybody, not all the time, and with respect to the current structure. But if you could talk a little bit about plantar fasciitis, possibly through the lens of kind of as a whole chain, represent up the chain a little bit, that would be amazing.
Yeah, absolutely. And I totally see the questions. And people have a lot of foot questions. Oh my goodness.
Yes.
So yes, so plantar fasciitis, the way that I describe this to patients, and obviously in this case, is your plantar fascia, which is a thick band of connective tissue on the bottom of the foot from the heel, runs across, inserts into all five toes, so it becomes these five slips. It is part of the rubber band that is used during the loading and unloading of dynamic movement and energy transfer. Okay.
So
Now,
it's responding to that locking and unlocking mechanism.
yes, it is one of the fascial components of that mechanism. Okay. So when you are loading, unlocking to absorb the energy, and I just want to add that energy of impact forces are vibrations. That's important because if I talk about plantar fasciitis that we're going to talk about, Achilles tendonitis, stress fracture, shin splints, it's important to note that impact is vibration. So
that is so important.
yes. So we're loading and unloading, and you're essentially demanding the elasticity of that tissue, the elasticity slash tensegrity of the tissue. So can it relax? Can it be a rubber band? And then can it tighten? That's all we're doing. That's all we're doing is dancing. If you happen to overload the capacity of that tissue to unlock and lock dynamically, you essentially start to micro tear it. And when you injure it, so you just kind of like, oopsies, pulled it a little bit too much, and then you create a little injury. That injury then starts to repair itself. And while it's repairing itself, you are still going about your day, your life, your activity, whatever you love to do. So you are stressing the injury while it's trying to repair. And this is very important. So then we start to get in this little cycle of it gets stuck. It actually becomes very chaotic in there because it's trying to repair itself and you're still demanding stuff from it. So that's kind of high level of what plantar fasciitis is. Now, different foot types, different jobs, different activities, things like that, whatever the stressor is a little bit more susceptible to plantar fasciitis because maybe a very overpronated flat foot can't stabilize fast enough to support the tissue while the vibration is going through it, just as an example. Or if I could just add real quick, let's say you stand on your feet for work. I work with many standing employees from first responders to TSA to
nurses. I have a lot of nurse clients with it.
It is very unnatural to be on your feet statically, or obviously there's some dynamics, let's say for a nurse, on concrete for a 10-hour shift. It's just unnatural. So now we're hitting this gravitational fatigue, and this is where pelvic floor is really important as well. But people just get fatigued in gravity over 10 hours. Then they're exhausted. They go home, go to bed, and then do essentially the thing again. So we get this accumulation of tissue stress, and that's really what plantar fasciitis is. So it's understanding how to navigate that injury cycle to get control of the situation.
Yeah, and I see that a lot of people also are trying to work on their plantar fasciitis and their pelvic floor stuff, but they're not necessarily changing the forces that are going into the pelvis and the lower leg. Like they possibly are wearing shoes with a heel all of the time, or they're possibly standing with their pelvis really far forward, or they have a big posterior pelvic tuck. And these things might be fine for 300,000 people, but then might be causing, like you said, that loss of dynamic stability and that kind of rupture without the repair again and again. So I do find that people are doing all their exercises, but they're not necessarily changing some of the underlying causes. And I think that the same thing goes with the pelvic floor. People do things for their pelvic floor, like Kegels, but it's like, hold on. Your Kegels are not going to be that effective if you're not really changing all the things around as well.
And that's why I always try to have people, like, don't ask Dr. Google how to fix something, because it's really about the timing of when they do something. Like, just where within the story of getting past plantar fasciitis, as an example, does doing short foot make sense? let's just say as an example, right?
Yeah.
And I very much, an important part of what I do, because most of my patients are chronic, so they have a
Yes.
tear in their plantar fascia. That's actually most of my patients. I have to first put out the fire. And
Right.
essentially I say, okay, I'm the chef, or I'm the one who's kind
Right.
of running the show here. We have to get control of the situation, and I'm going to kind of direct you through this healing process,
Yeah,
because it's hard, but people
for
don't know
sure.
what they don't know. And that's why I love educating. And I know that's a big reason why you educate,
Yeah.
is we're all trying to do the best that we can with the knowledge that we have. So we need trusted sources to really guide us through this process.
Some of these conditions require a bespoke
Yeah.
way of approaching them, and not just the 5 exercises, because the 5 exercises might be wonderful, but everything, or there's a few other things to tweak. So we have just a few minutes left, and what I would love to talk about is, I think you and I are very much on the same page that our foot is this incredibly valuable body part that is full of thousands of nerve endings, the ability to sense and feel. Our feet are like a GPS, they're like a navigator. They are so sensory, and yet we cover them with these shoes that then kind of numb and dampen everything. I would love for you to talk about how that, again, I think drawing the connection between how dampening those connections up the chain. Because I think that people think of their bodies as these isolated, siloed parts, where that's not quite how it works. So, and then I think what people do is like the feast or famine. They're just like, oh, shoes are bad, I'm going to stop wearing them. And then they get injured. They're like, you see, being barefoot's bad. And it's like, wait, oh gosh, hold on here. So I would love to talk about what you think about like shoes, no shoes, neurons, no neurons, like the value of our feet. And then again, how these things express, how the loss of connection of the foot could express itself in the hips, the glutes, and the pelvic floor.
Yeah. So I love to talk about the sensory side of the foot. That's my shtick. Traditional podiatry is very much looking at the foot from a biomechanical structure, and it's a bag of bones that is pronating and supinating, and that's how we move. Where really, this is from a human movement perspective. This is how we stand on our feet. This is how we walk. Is that, yes, your feet are like a GPS. I think that was so creative, and I love how you describe the foot in using these words that people can really resonate with. But yes, the skin in the bottom of the foot is packed with thousands of nerves. That is by design, because again, it's the only contact point between the body and the ground, which means it is supposed to read every step that we take and then auto correct based off the impact forces, our body weight, the surface, etc., so that we can absorb the energy from the foot strike, store it in our body, and really release it as elastic energy like a rubber band. This is the foundation of moving what's called efficiently, which just means very far with very few calories. That's what we want to do.
Yeah,
Now,
so that every step is effective, right? Efficient. And transmits through the body effectively.
Yes. Now, this is where it will connect to the hip, the pelvis, the pelvic floor, is that the impact forces in the ground is really the trigger to the stabilization mechanism during dynamic movement. So if you can't feel the ground, feel the impact forces, that trigger is often delayed. It's either insufficient, inaccurate, or delayed, which means the timing of pelvic floor, deep hip, glute activation is going to be just a little bit slow, which means now your lower leg is not stable. You hit the ground harder than you should, and now you have plantar fasciitis, as an example.
Less sensation, less information.
Yes. So we start to get this effect, right? This from the ground up effect, which then can start to lead top down effect even more, and they just feed into each other. Now, footwear, which is a huge thing, obviously, because now we're walking on concrete and all these different surfaces. We're standing as a nurse on these artificial floors, that there is a role for footwear. The way that I guide footwear is always based on three things: your foot type, your injury history, and then the demands at which you're going to put your foot under. Right? So that's why I believe in natural footwear. I want a majority of people in a majority of situations, to be as minimal as they can, right? As they can. And that's because as soon as you put anything under the foot, including the most minimal shoe that is on the market, you are still creating a barrier between the nerves and all that information that we're moving on. So that's ideal. But if you are standing on your feet as a nurse should not be standing on the hospital floor in vivo barefoot.
I couldn't agree with you more.
I
couldn't agree with you more. Absolutely. Our bodies are not designed for hours of standing around on concrete. Yes.
Exactly.
Thank you for saying that also, because people get so black and white about it all.
Yeah.
And then disappointed in the results and then blaming like the obvious culprit, which might not be the actual culprit.
Right. Exactly. So I believe that it's about taking ownership of your feet, your pelvic floor, your body, your movement, understand your unique structural type of, here I'm talking about feet, but let's say your foot type, understand what that foot type means, and then how do you utilize the tools to optimize the function as much as you can based off of the stressors. And if that means at work you wear a little bit more structure, that's okay. And then on the weekends or at the gym, you're doing some barefoot, you do yoga, you do Pilates, you're getting out of it. It's about finding that balance. And that's really important. And to me, I think most people think I'm going to give like this, like black, white response that like everyone should be in minimal shoes, but I can't do that. I understand the exceptions to that rule, and I need to educate and help people know when they are the exception to that rule.
I think that's what I really appreciate about your work too, is that you love human movement. You understand human movement. You understand gait. You understand all of it. But you also understand what we're coming to the table with. Somebody might be coming to the table after years as a ballerina, or they might have Ehlers-Danlos, hypermobility, or maybe they were a surgeon bending over all day long. Like every body is so unique, and we can't just assume that there's one optimal for one body type. And I love that you bring that to the table. So that's amazing. I see a few questions. We don't have time for any more, but I just want to affirm. I see a bunch of people commenting on the tongue, jaw, pelvic floor and foot connection. And I just want to step in and say, and if you have like a 2-minute liner about it too. Yes, there is a huge connection. I don't know about in your work, Emily, but in my work, I'm very cautious about, now that you know there's a connection between your tongue and your foot, and it includes your pelvic floor, that doesn't necessarily mean you need to go home and just like rub your tongue, rub your foot, rub your pelvic floor, and everything will be okay. And sometimes working on just one area, like working on restoring function to the foot, will absolutely, what I see is start to create function up the chain, rather than thinking like, oh, there's a connection between those three. Let me go and kind of like roll them out or do some strengthening exercises. And it comes back down to like, if you think you are having a connection in those areas, that bespoke kind of approach is really helpful, but also knowing you don't have to skin the whole cat, like working on part of it will lead to the rest of it. I don't know if you have a similar context. I know it's our last minute together, but just to give people some idea of like, if they are feeling the connection up the whole chain, how they might manage that.
Yeah. So I use the connection between toes, pelvic floor, tongue in like an athletic performance. That's typically where I use it more, or to teach stabilization mechanisms. So I like that people use it. So versus dysfunction, pain, that side of it.
Got it. Yes. Enhancing performance.
Yes. Enhancing performance by realizing that there is this soft tissue skeleton that exists, right? So just from like an athletic perspective, because that's where I use a lot of it, is that the coach understands the tensegrity mechanism of this connection. Yeah. And then to utilize it just in their cueing. And then honestly, I feel that when people realize it and they're doing something, then they can inherently or internally understand why they're doing something. So like
awareness.
And awareness, right? So when I lift, and I don't put my tongue to my palate, it's behind my front teeth, but I think that, not this will totally go longer than a minute, is then understanding like the clenching of the jaw.
Yeah.
To me, that's actually more, and I know you do a lot of work with like somatics and trauma and stuff like that, is that aspect of the jaw and the tongue and the mouth, to me, is really fascinating to what it could inhibit down the chain.
Totally.
But then say, okay, if there's some intent behind the tongue, and even I'll just say, look at Simone Biles. There will be videos of her very intentionally doing something with her tongue when she's doing her gymnastics with Michael Jordan. There's a reason why they do it. They probably don't even understand it, but there's a reason.
Yeah.
And it's a powerful connection. So I'm just going to leave it that, yes, it exists.
Yeah, it's a connection. But you don't need to feel overwhelmed to attend to every element of the connection. And that because things are so connected, I think that when you attend to one area, it starts to influence the other.
100%. And I always tell people you're just saying hello to these areas. Because I've had people short foot themselves to plantar fasciitis, Kegel themselves to pudendal nerve entrapments.
Yes.
I don't know what they would do with the tongue, but something to TMJ. But it's, you really remember that we dance in and out of this lock, unlock. It's happening within milliseconds. So it's just more like, hello foot, hello pelvic floor, hello tongue. Like it doesn't have to be like, and
I love that. That goes for everything in life. We unlock and lock into everything. Don't want to spend too much time in any of those positions.
Yes.
It was so nice chatting with you.
Likewise. I love the synergy. I
do too. Yeah, I do too. And I think that people definitely want to explore this topic so much. So it's so nice that we got to dip in and do that here now. Thank you. Thank you so much.
Of course. I hope that if anyone has questions, I'm always sensitive of people having questions and then being like, I want my question answered. Yes. People can reach out to me and ask questions.
Thank you. Me too. Of course.
Yeah. And then of course you as well. And then we'll just have to do this again because clearly there is a lot.
Clearly we need to do this again.
Yeah.
Thank you. Thank you so much.
Of course. Thank you.
And thank you to everybody watching, and goodbye.